listening to Beyond Wellness Radio, bringing you the cutting edge in health, nutrition, and sports performance. Stay up to date and listen anywhere, anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your hosts, Dr. Justin Marchegiani and Barris Harvey, as they answer your burning health questions, as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Hey there, this is Dr. Justin Marchegiani, and welcome to another awesome episode of Beyond Wellness Radio. Again, we have a great show in store for you. Before, go to beyondwellnessradio.com. Click on the newsletter sign-up button. You can sign up for our newsletter and get show updates right in your inbox before anyone else. You can also click on the questions button and even speak questions live, and we'll be able to answer it on the air for you. You can also click on the write a review button. If you really enjoy the show, write us a review. Let us know on iTunes. Let the world know. Think of one person that would benefit from listening to this show and share it with them. Sharing is caring. Also, check out justinhealth.com, which is my personal site. Again, I have some complimentary functional medicine consults available. You can also sign up for the free thyroid series and female hormone series as well. You can also go to reallyhealthynow.com. That's Barris Harvey's website, where he has some great articles and blogs and videos for you there as well, and even some consultations. Again, we have an awesome show in store. Stay tuned. Hey there, it's Dr. Justin Marchegiani with Beyond Wellness Radio, and we got Dr. Lauren Noel here in studio, well, kind of, at least over Skype, and we're really excited to have Dr. Lauren here. She actually rescheduled on me twice because she's so busy, but I'm so happy we were able to get her in. Dr. Lauren, how are you doing today?
I am lovely. So excited to finally be here. Third is a charm.
Yes.
Thanks for having me.
No problem. No problem. So tell me, what's going on with your clinic? I know we chatted a little while ago, and your clinic's been on for about, I think, a year and a half, and you're rocking it, helping lots of people. Can you tell me about how the clinic's doing?
Oh, man. I am beyond amazed at how it's taken a life of its own. It's just amazing. I started the clinic, Shine Natural Medicine, a year and a half ago, and my vision was creating a place that is not only empowering to patients, but also to the staff, and a place where we all get to come together to really just develop ourselves personally with our health. I wanted it to be a hub of community, and it's completely done that. It's we have events here at the clinic. We just had our anniversary party a few months ago, and it was so much fun. And we had a photo booth. Patients were coming in and taking pictures, and we had healthy foods and drinks and music. We had a DJ playing, and it's just become a place of so much fun and health, and it's exactly what I envisioned and more. So I'm pretty happy about it.
That's really good. Awesome. And I see you got a new website up at shinenaturalmedicine.com. The site looks super awesome, and I see you got a newsletter on there. So you're starting to send out blogs or videos every week now?
Yep. We are sending out weekly tidbits, recipes, health tips, just keeping people in the loop of what we're doing at the clinic. And we send out, fun videos, just something to inspire you and give you some good little, pearls for your health. And we like to keep it simple, but also some useful information. So yeah, it's a lot of fun.
That's awesome. Really cool. Well, now that I have you on here, I really wanted to talk about female hormones, and especially the area of libido, sex drive, and fertility. So I'm just going to kind of open it up there, and why don't we touch upon fertility right now, and just some of the things that you think need to be in place with your patients to be really fertile and have the best chance of having a healthy pregnancy.
Yeah. God, don't you see so much in your practice? There's so many issues with fertility nowadays. It's amazing. And all the time. And I think couples are embarrassed sometimes to talk about it because they think that as soon as they start to try to get pregnant, boom, it's going to happen. And they're going to have this, beautiful, joyous pregnancy and no stress. And a lot of times it doesn't necessarily go that way. Mm-hmm. Infertility is on the rise a lot more than it's ever been before. And I think there's a lot of things that are involved with this. But the first thing that I start with patients is a pre-fertility kind of plan. So we're getting your hormones balanced. We're getting space created in your life so you actually could have a baby. I just had a patient the other day, about a week ago, came in. She's a very, very busy lawyer, and she works like 70 hours a week. And she's like, I want to get pregnant. And I go, you have no room for a baby right now. You're not going to get pregnant because you just cannot actually take this on in your life right now. And with our follow-ups, she's been creating more space in her life to do this. She's getting acupuncture. She's taking more time to, cut back on her hours and meditate and relaxing a lot more. And her hormones are starting to get a lot more balanced. And it's been just basically cutting back and saying no.
Yeah.
And I think that's one of the biggest, takeaways for women, especially because if you're stressed, you're going to have a hard time getting pregnant. So we live in a very stressful day and age. I mean, there's so much on our plates now. And, cutting back and really balancing out life is just really huge for fertility. I'm sure you see a lot of this too.
Yeah, absolutely. And, we know from like a lifestyle perspective, like the meditation, sleep, blood sugar, like these are kind of foundational. But what are some of the things that you're doing from a functional medicine thing? You mentioned hormones. I know you do a lot of IV nutrition in your office too. What are some of the extra things that you do that you find really helps improve a woman's fertility?
Yeah. So first thing is getting a baseline to see where we're at. So definitely looking at hormone testing, doing a good day 21, seeing where your progesterone's looking at, your estrogen, adrenal panel. So doing a salivary adrenal test. And if you have healthy adrenals, you're much more likely to get pregnant. If you have that flatline adrenal, your body is just trying to keep up with life right now. You're just not going to be able to sustain a pregnancy as easily. So doing the salivary cortisol testing, really important. I use BioHealth. I think that's probably what you use as well.
Yeah, exactly.
Just really good hormone testing. And then also looking and seeing if you have any nutrient deficiencies. So specific ones, magnesium is huge for fertility, B vitamins, the methylation, which I know we'll probably touch on. So seeing how your folate levels are looking at, your B12, B6 is especially important for hormones for women. And so getting your nutrient levels on track before you get pregnant, because once you get pregnant, that baby's going to be sucking up those, those nutrients for you. Exactly. So you're going to get the leftovers. So getting to the point where you're just optimally well, that way you can get pregnant and stay healthy during pregnancy. So you're not going to have the postpartum and just feel so depleted after having your baby. So testing for nutrient levels, I run labs through SpectraCell. I like them a lot. You can also use the Nutri-Eval from Genova, and then just getting on a good program. Typically for my patients, I'll do a 10-week plan, retest, see where we're at. And oftentimes within like one or two plans, I mean, it's a big difference with how the nutrient levels are looking, how the patient's feeling, a lot more energy, feeling like sex drive is a lot better, cycles more regular. But I love using IVs for the reason of absorption. We know that there's so many digestive issues for patients nowadays. And so getting a good dose of those nutrients right in the bloodstream is so much more effective than a supplement.
Oh, that's great. So you kind of hit upon two different topics I really want to touch upon. So let's hit the first one here. Let's hit libido and sex drive. So we can talk about it from a male perspective. We can talk about it from a female perspective. But why don't you, address some of the underlying hormonal imbalances that you see in a lot of your female patients with low libido? And is it just about giving a hormone to fix that, or are there other things you're doing in conjunction with just maybe hormone support?
Yeah. And this is one especially for women. I think they kind of have some shame around this. They go, oh, I have this amazing boyfriend, amazing husband.
Right.
It doesn't make any sense. How could I not have a sex drive? And yet I just don't really feel it. Yes, I'll have sex because I want to make him happy, but I'm just not really enjoying it. And it's just so common to see this even in women in their 20s and 30s sometimes, or younger and having regular cycles. They'll just feel like don't have this kind of sex drive happening. So one of the biggest things I see, I know you see it too, is stress hormones.
Yeah.
Cortisol is the best killer for sex drive. If you want to kill your sex drive, get your cortisol levels out of balance. I mean, it's it makes a lot of sense for when women say they go on a vacation and then they feel more sexual because they're relaxed. They're in a place where they're able to then, be in that kind of space, more in that sexual kind of space. And so that's first and foremost. You want a healthy sex drive, you got to balance out your stress. You got to cut back on what you're doing. If it's meditation, that's going to start your day in a more mindful kind of way. I started doing meditation recently and it has completely changed my life. And I'm able to have a sense of calm in the midst of chaos. It's crazy.
That's great.
Yeah, I mean, I've been trying to meditate, literally trying to meditate for years. And
Are you using an app? Are you using one of those apps that are out now?
Yeah, I use an app called Headspace. Have you heard
Me
of that
too.
one?
Yeah, I
Really?
use Calm and Headspace. I gotta go back and forth with them. The Headspace kind of has the Aussie guy, and the Calm has the cool English girl in there. So
Ooh, I haven't heard of Calm. It's just Calm, Calm.
CAL, yeah, it's a good one.
Okay, cool. Yeah, Headspace has been amazing for me because I think before I would use different mindfulness apps and I would get a little ADD trying one and trying another, but I liked how Headspace was like you build one day at a time, and that really worked for me. So yeah, I've been on, I think, day 40 that I've been actually really consistent
Wow.
with using it. And I tell you, I have more on my plate now than I ever have, and doing that has made it to where I can keep up.
Very
So
cool.
yeah, so building in more of that kind of stress support is especially important, and then getting your hormones balanced. So low testosterone, huge for women. Most women typically think, oh, that's a male hormone. I don't need testosterone, but no, women do need testosterone. So that can be really, really helpful for getting your sex drive on track. And then DHEA too. So DHEA for sex drive, also for the quality of the eggs, actually. So doing kind of a higher dose of DHEA for women can improve the quality of the eggs in order to to get pregnant.
And won't DHEA also affect testosterone? It kind of flows downstream and potentially
Exactly.
increase it.
Yep, exactly. So rarely I won't really put a younger woman on testosterone. Typically we'll do some pregnenolone and some DHEA, give you those, kind of the precursors, and then
Yeah.
have that flow into the testosterone, but huge benefits.
That's the same approach that I have. Cool.
Hmm.
How
Yeah.
about herbs? What kind of herbs do you do? Do you like maca, like Peruvian ginseng, or is there, um, I'll let you kind of just touch upon some of the herbs that you like.
Yeah, maca is a great one. I've recently started using Mighty Maca. Do you know Dr. Anna Kabeka?
Yeah.
Yeah, she's put together a really good product with Mighty Maca. I
Cool.
love that. Yeah, it's a good adaptogen blend. It has some greens in it too, and then the specific kind of maca that she's used is just a very good quality. And so we start with just 1 scoop and ramp up to maybe 3 or 4 scoops. You can put in a little bit of water and drink that down, and that is awesome for sex drive. And I've used that also feminescence. I love using that as well, and that also for men and for women. I know that NHI has put out a good product with feminescence for women. I think the men's is called Revolution Pro, but maca is so great because it works on the HPA axis. So it works on that whole, stress kind of loop with, it's not all about, we just want to boost your testosterone, right? We want to have your brain, your adrenals, the ovaries all communicating with each other. And so maca really works on that kind of axis and in a great way to firm up those pathways.
Very cool. What's your experience with horny goat weed? Have you tried that one before?
I just love that it's called horny goat weed.
I know. It's hilarious. There's a story about this. I was 22. I had like chronic fatigue. I was in college, and the naturopath slash chiropractor I was seeing recommended it to me. And I remember like, what the heck is this? And I thought I got amazing results from it
Did you?
personally. So what's been your take on it?
I found the same thing, actually. There was one patient who I had on it. We had to take him off because it was like too much for him.
Yeah.
So I don't know if you had that experience, but yes, I haven't used it as much for women. I don't know if you've used it for women, but for men, it's been really good results, actually.
Okay. All right. Very cool. Very cool. Any other little herbal secrets you have?
Let's see, for sex drive. Let me think about this one. Yeah, I think that's the biggest one. So the maca, the DHEA, the pregnenolone, cutting back on stress, it's the biggest one. And then just really because I work mainly with women, getting into the feminine, I think is huge. So the more that a woman really works in her masculine and trying to be just that forceful kind of masculine nature, I think that's a big killer for sex drive too. So getting more into your feminine, getting more into your body, whether that's, using more dancing or, belly dancing. I actually have one of our new doctors in the clinic. She's a professional belly dancer. She actually leads workshops on that. So, and she's very vibrant and has this very like sexy kind of nature, and it's inspiring. So I think for a woman, like really getting into your body, and one thing I say is dance naked to music every day. Pick one song and dance naked to it every single day, and you'll get used to being in your body a lot more. Because I think we have a lot of body issues. We see a lot of images of how a woman should look, and that's a big killer for sex drive too, because you see yourself in the mirror and you go, I don't match up. I'm not pretty. I'm not sexy. And that's just such BS. Get into your body and really own that feminine power.
Very cool. And especially talking about fertility, a lot of the women that have these, super skinny body types, a lot of them, they may not even be fertile because their body fat is so low.
Yes.
Can you touch upon low body fat and fertility as well?
I'm so glad you said that. Eat fat.
Yeah.
Huge. I kind of, it's like for me, that's such a no-brainer. I almost forget to mention it sometimes. Low fat diets, that will give you a low sex drive because you're not going to be making the hormones that you need. So the building block for your hormones is cholesterol. I'm sure your listeners know this, but it's like if you think of Legos, that big main Lego piece is cholesterol. And then you add one little piece onto it, you get, progesterone or estrogen, testosterone. It's all with that main piece of cholesterol. So you want to have those good, healthy fats in your diet. If you're eating some chicken, eat the skin. If you're having some red meat, you eat the fat. Have butter, have coconut oil, ghee. I mean, all these kinds of fats are so incredibly helpful. And I got to say from experience, back in the day when I was a vegetarian, my hormones were crazy. My cycles were, I was having a period every 2 months.
Oh, wow.
And now my cycles are right on track. At 34, my cycles are more regular than when I was 24. So nutrition is really fundamental for fertility, and fats is really where it's at.
Well, that's really cool. I never knew you were a vegetarian. That's the first time I heard that.
I think all of us at some point were, but were you a vegetarian, Evan?
You know what? I was on this super low fat kick for a while thinking fat was bad. Right. And that screwed me up. And I was super gluten sensitive because I have an autoimmune condition. So I was eating I remember being in my exercise science class freshman year in college, and they gave us this NutriCalculator, and they would basically give us these assignments to track all of our food. And I remember coming in so proud to the professor being like, look, I ate 12 servings of grains yesterday. And I was so proud. And everyone's high-fiving me. And I'm like, yeah, 65% of my carbs were grains. This is perfect. And then I look back, I'm like, oh my gosh, no wonder why I had all these health issues and brain fog. So yeah, I kind of was, I made mistakes on other ends of the coin there for sure.
Oh my God, I totally relate to that. Yeah, back in the day, in those days, I was vegetarian, lots of grains. I had raging acne. I was on Accutane twice. Yeah. I had, irregular cycles, digestive issues, a thyroid condition, and so much of it was related to diet. And after even being on Accutane twice, my skin still did not clear up. It wasn't until I cut gluten out of my diet, cut out the grains, added in more fats, and then boom, my skin is clearer than it's ever been. My cycles are regular. Nutrition is so powerful.
It is. It totally is. And on the topic of fertility, can you touch upon digestive health? How important is digestion with fertility? Can malabsorption and digestive issues drive fertility and libido issues?
Oh my gosh. Well, as a naturopathic doctor, I'm always saying that your digestive tract is the center of the universe. It controls so much, not only your absorption, but your immune system, your neurotransmitter balance, your hormone clearance. If you have chronic constipation, you're going to have issues with balancing your estrogen. Right. So there's a big connection there that most people have no idea about. You also activate your thyroid hormones, a good percentage of that in your digestive tract.
Yeah.
So if you're having continual constipation, diarrhea, absorption issues, again, not only are you going to have deficiencies, but your hormones are going to be majorly affected by that. Testosterone, so your thyroid and your estrogen levels for sure.
And that makes sense because you mentioned cholesterol being a building block of our hormones, and if we can't break it down and metabolize it, well, then we're not going to be able to make the hormones. And also, I think you talked about zinc earlier, and zinc's so important for our sex hormones too, right?
Exactly. Zinc, important for sex hormones and for your thyroid. You need sufficient zinc levels. Yeah. And actually zinc for fertility. Hello. For sex drive. Yeah. Right. And that's why oysters are an aphrodisiac because it's just loaded with zinc. I prescribe oysters all the time. I don't know about you, but I'm always telling patients, oh, you're low in zinc, eat some oysters. And I that's my regular routine at the farmer's market. Have maybe 5 or 6 oysters and I'm good to go.
Very cool. Do you ever do a zinc tally test with your patients?
I did that a lot in medical school. I haven't done it as much just because I do run the SpectraCell, but I think I'm going to get back to using that. Yeah, it's a fascinating test, and it's so easy. It's so interesting because it's like if your zinc levels are good, that zinc is going to taste nasty.
Nasty.
But if your zinc is down in the dumps, you're not going to even taste it. It's going to taste like water. Isn't that amazing?
I know, it is really cool. So people that are listening, what Dr. Lowe is saying, the better it tastes, that means the more deficient you are. The worse it tastes, the less deficient you are. And the faster it tastes good, meaning the more deficient, the slower it tastes bad. Then it's kind of in the middle. So the faster it's good, the slower it's bad. That's the best.
Yeah. Yeah.
Cool.
So if it tastes nasty to you, that means that you have a good amount of zinc in there.
Yes, absolutely. Very cool. Well, Doc, I know you do a lot of IV nutrition, and we know today with leaky gut and chronic gut infections. Can you talk about, leaky gut a little bit and some of the things that you're doing in your office with IV nutrients and even B12 and intramuscular injection work as well?
Yeah. So nowadays, I mean, so many of us are having digestive problems. This is the culture that we live in, the standard American diet, the environment we're in with the environmental toxins. We just have the kind of life setup right now that is very conducive for leaky gut, unfortunately. Antibiotics, medications, birth control pills, all of these we know can really set up the digestive tract to have inflammation and permeability. So I think especially kind of in the paleo sphere, we hear leaky gut so much and it's almost like this buzz term. And I think sometimes people kind of roll their eyes at it thinking it's not a real thing, but it is super real. And now finally conventional doctors are coming on board and actually seeing it as something that's legit and medically sound. So finally the gastroenterology journals are now being, the information from that is translating over into more of the conventional medical realm, which is great. Not fast enough, but it's starting to happen. So leaky gut is really huge. And like I said before, leaky gut contributes to everything else. Nutrient deficiencies. If you have leaky gut, you're going to have some nutrient deficiencies. Yeah. And if you have leaky gut, you're also going to be more likely to have issues with low enzymes, low stomach acid, dysbiosis of your gut, so imbalance in the flora. And this also contributes to things like parasites, candida, infections in the gut, which then kind of worsens. It's sort of this whole cycle because you get these infections and then it's like it feeds back into damaging the digestive tract even more. So the benefit of injectable nutrition is it completely bypasses the gut. We don't have to worry about, are you going to get this supplement absorbed? Are you going to get the benefits of changing your diet absorbed? So going right into the bloodstream, it's 100% absorption. So we use both intramuscular shots and also IV nutrition. And we decide to go one or the other based on the patient, based on the condition, based on cost. Yeah. Cost-wise, but I love using it for patients, especially with like inflammatory bowel disease. So ulcerative colitis, Crohn's disease, celiac. I mean, it just really is especially good for those kind of situations, autoimmune disease. I'm such a believer and using, I've done IVs in about 5,000 patients now. Whoa. So I've been able to see what works, what doesn't work. And for those specific patients, it can be pretty miraculous.
Yeah, I remember seeing you back in the fall at the Bulletproof Conference, and you were with lines of people you were doing IVs on back then.
Well, that was a perfect crowd for that because whatever Dave says to do, they're like, yes, sign me up. Yes. And we said, okay, do you want to bulletproof it? Which means you want to add glutathione? They're like, yes, whatever you want, we're going to do it. And so, it was a very captive audience. But I think we did I don't know, maybe 50 or 100 IVs in I think it was 2 or 3 days we were there.
That's so cool.
It was a lot, yeah.
Very cool. So can you talk about why you would do an intramuscular injection over an IV and what the benefit is?
Yeah.
For one or the other?
Most things we can put in an IV. There are a couple things not so good in an IV, like something that's fat soluble. So like vitamin A, for example, tends to be a little bit better to do in a shot. You don't really want fat droplets in your IV. Doesn't really absorb as well. Also, vitamin D is one we don't typically do in an IV. But generally speaking, in an IV, we can do magnesium, which is very important for female hormones. We do zinc. We've talked about that. Selenium, we can throw in there too. All the B vitamins, so B1 through 12, trace minerals, calcium, vitamin C, and then we can get really specific in throwing in things like glutathione, which is hugely important for autoimmune and for anti-aging, amazing detoxification stimulator. And so the IVs, we can do a lot higher dosage in the bags, but with the shots, again, so things like vitamin A and vitamin D, you want to reserve to a shot because it's more of a fat soluble nutrient. Also, there are some things in an IV you cannot put in a shot, like vitamin C tends to hurt because it's ascorbic acid, so it doesn't really feel as good. Zinc, I've never done in a shot. I think that would probably be pretty tender. So it just depends on the comfort for the patient, the way that the delivery would go. But for most people, I usually use IVs and shots because we can get really strategic on what can go in each one.
Oh, that's very cool.
Yeah.
And regarding like an IV, if I were to get an IV, is just your basic Myers cocktail good enough, or what would you recommend to the average person that's just stressed and just wants to get a nice little boost?
I would probably do our toes in the sand formula. So our clinic, Shine Natural Medicine, it has kind of a beach theme. So all the different formulas have a beach name to it. So the toes in the sand is really geared towards stress relief. So I know
Great
you're a
branding.
busy guy. Thank you. You're a busy guy. You're running a clinic. You know, you're a husband. You're doing a lot with real estate. So you have a lot on your plate. So I would, for you, probably add in a little bit more magnesium and also vitamin B5. B5, dexpanthenol or pantothenic acid. That's the main, B vitamin for adrenal function. I'd probably do double vitamin C for you too, because the adrenals just love the extra vitamin C. But yeah, I would do basically like a sort of a modified Myers cocktail for you and do more stress support. And then also things like L-carnitine is great for supporting, fat burning and for the muscles. And then probably extra taurine too. Taurine is a great amino acid that really works to drive the minerals into the cells. So even though we're doing some good minerals, helping to drive them into the cell, the taurine can be really useful for that.
That's cool. So toes in the sand. What other awesome names do you have? I'm looking forward to hearing these. What are they?
We have our Lifeguard formula. That's for immune. So if you're getting sick, that's an amazing formula for that. We also have the Motion of the Ocean. So that's a sex drive formula. We have our...
so hold on. We have to stop on that. So what's in the sex drive formula? Is it maca and zinc, or what do you have?
Yes, we have extra zinc and also extra B6 because that helps to support your estrogen levels. So yeah. And then for the, we have the, Motion of the Ocean, Clear Waters. That's our detox formula. So we do extra glutathione with that. We can also add in molybdenum. So that's an important mineral for detox. And then going off the top of my head, we have what was the other one? We had Toes in the Sand, Motion of the Ocean.
Clear Waters.
Clear Waters. And there's one for energy. Seize the Day. So SEAS, so Seize the Day. So that one is a lot more for energy. So that definitely has extra B5. And then we have some homeopathics that we can add in for that too.
Very cool. Well, whoever's doing your branding is doing a really good job.
You're talking to her.
Oh, awesome. Very cool.
Thank you.
And do you still have your little bus thing where you kind of drive around and give the happy hour shots?
That was at my previous practice. We're not doing that right now, but and the IV therapy laws have been taking some changes. So I don't know if we'll be able to do that. I know it's unfortunate, but if we can get around to doing that again, we definitely will. But I love doing the mobile IVs and the shots, just coming to where you are. It's so much more convenient. So yeah, we may visit that again.
That is so cool. So let's talk about B12 injection. So we have lots of, stuff out there like Ben Lynch and all these different people talking about methylation and folate and B12. And should you do methyl B12, cyano B12, adenylyl B12? Should we use activated folate? What's your take on that? And how are you essentially giving it via injection?
Yeah, that's a really good question. I test patients for methylation defects. So I'm doing testing to see what their MTHFR potential mutations would be. And then from that point, I look and see, okay, is it important that we do methyl nutrition for them? So for people listening are familiar with this, for example, folic acid, we hear of that being super important for fertility. I know women, when they want to get pregnant, they're taking folic acid, but unfortunately, folic acid is a synthetic form of the vitamin. It's not something that your body really recognizes. So it's important to use a methylated form of that. And so in any supplement that we use out of the clinic, we're always using methylfolate. But the cool thing is that's the kind of folic acid or folate that you get in dark leafy greens. So if you're eating a really good diet, you're eating lots of dark leafies, you're already going to get that in your diet anyway. Now, when it comes to using methyl versus not methyl, like for example, B12, what I typically do, I will use methyl B12 with most people. I find in my practice, most people do best with that. Occasionally there is someone who will say, that kind of made me feel a little bit too maybe anxious, or that had me feel just a little overstimulated. If that's the case, then we'll switch to doing the hydroxycobalamin.
Yeah. I'm
typically not using the cyanocobalamin. It's not even something I carry because I find we don't usually need to use it. What about in your practice? What are you finding with the methyl B12 versus the cyano? I'm curious what you're using.
Well, a lot of times with patients that have methylation, function issues, we'll use the metformin, where it's a B12 and a L-MTHFR or an L-MTHFR, and we'll do it sublingual. But we'll run the organic acid from time to time, and we'll see people needing adenosine B12. And then we'll use Zymogen makes a really good one. I think Ben Lynch's company, Seeking Health, has a really good adenosine B12. Allergy Research has a good one, but they messed it up because they put a little bit of folic acid in there with it. I'm like, you guys got to pull the folic acid. So
it's an amateur move.
I know. So typically the methyl, the MTHFR, the L form we'll do, and then if it says, we'll do the adenosine.
And what percentage of patients would you say are doing methyl versus adenosine?
You know what? I would say a smaller percent. I'd say maybe a quarter to a third are coming back with adenosine. But most, I think you can't go wrong with the methyl. And I think cyano isn't as good. Methyl's going to be, I think, the best way to go. Would you agree?
Yeah, totally. I concur. Yeah, and I've been wanting to run more of the organic acids. And that's on the organic acids panel, right?
Yeah, that's right under the methylation side, which is really cool.
Okay. Yeah. You've sold me on that. Yeah. And I love Zymogen. I think they have some good products. So it's what's the specific product by Zymogen that has the adenosine?
It's actually Seeking Health. Again, I think Ben Lynch uses a lot of Zymogen stuff. It's the Seeking Health adenosine product.
Okay. Awesome. Thank you.
If I find it after the show, I'll shoot it to you.
Thank you. Yeah. That's
cool.
That's very useful. It's very rare that I'll see an issue with the methyl, but occasionally they'll say, I just felt a little bit kind of sort of jittery or wired with that shot. So I think that might be that subset of people that could use the adenosine.
Yeah. And there's actually been a lot of patients coming in this week, myself, where we're testing them and they're coming back anemic, and not the B12 folate kind that we just talked about, but iron-based.
Oh my gosh, huge.
And what's your experience using IV ferritin or IV iron?
Miraculous. Miraculous for patients especially who have maybe tried the oral iron before.
Yeah.
And it can be very constipating for them and just cause a lot of digestive upset. And also too, like with the whole leaky gut thing, if they have leaky gut, getting their iron levels turned around, it can take a long, long time to do. So IV iron is like the clouds part, angels are singing opera, huge, huge, huge difference. And some patients just tend to need a little bit more support kind of ongoing with that. So what I'll do first thing is do an iron panel, see where they're at starting point, look at the ferritin. If I see a ferritin below a 20, I'm probably going to be looking at doing some injectable iron. And I've seen it as low as I think 4. So what's the lowest ferritin you've seen?
Yeah, I've seen right around there where like LabCorp will highlight it in red and say alert.
Yes. Yeah. And the important thing is when you're starting IV iron or iron shots, starting very, very low and working up because it does have a higher possibility of allergy. So we'll start with just 1/4 of a milliliter in the IV, start very, very low, and then just gradually work our way up. And we'll get up to 1 to even 2 milliliters in that. And within 1 to 2 months, we see the levels like completely different. And usually maybe once or twice a week. Occasionally I'll do even 3 times a week if they're very, very anemic. But it's my favorite thing that we have for people who are really anemic.
And do you ever do injections for ferritin?
Yes. Yeah. So we'll do what I use is Dexferrum in the clinic. That's what I've used and found that it works best in terms of pain. Yeah. We used to use something called Iron 59 and that was really painful. So switching to something that's a little less painful, it is expensive so that the cost issue can be an issue for some people. But yeah, so we'll do the iron shot. It has to be done a specific kind of technique called a Z-track just to prevent getting any like bruising, or you can get like an iron stain mark. So making sure a doctor who's really trained in doing that. But yeah, so we'll do either in the bum. So we'll do like kind of the hip area or in the IV.
Can you go into what that Z-track was again? I'm really curious.
Yeah. So normally when you get a shot, you just basically do perpendicular. You just insert the needle right in and you have a lot more, cushion back there than what you might think. So you can actually use pretty much the full length of the needle. With the Z-track, what the goal is to create basically a traction where so how can I explain this? So basically if I'm giving this to a patient, I'm going to use let's say my left hand, let's say it's on their right butt cheek. So I'll use my left hand to traction up. So it's sort of like stretching the skin up and then I'll insert the needle and then, so I will insert the contents of the shot. And then once the shot is done, I'll actually keep it in there for about 10, 20 seconds or so. And then as I release the needle out, I let go of my left hand, so that basically what happens is it sort of like traps the contents of the shot deeper in the skin, so that when I release the hand, the skin that is now going back to its normal place, it's how do I explain that? Am I explaining that okay?
Yeah,
no,
that sounds good. Yeah.
Yeah. So it traps the contents of the shot so that it doesn't seep back out from where it was injected from. So sometimes when you give a shot, you can have a little bit of the vitamin, kind of like you got to wipe it with a little cotton pad. So if you do the Z-Track, it's much less likely to get that. So it traps it deeper in, and so you're not going to get that staining, basically.
Very cool. I know that was a very nerdy question, so I mean, it caught you off guard with that.
It's probably easier with the video, which we do have a video to show patients, but it's something we just do on ourselves. I mean, I don't even let patients take iron shots home.
Got it.
For many patients, they'll take home the B12 shots. We can show them how to do it, but that one we just do in the clinic so you can get the staining.
Very cool.
Yeah.
And I've been seeing a lot of patients come in anemic, like I just mentioned, and we have, a couple different causes, as you know. Maybe if you're vegetarian, that could be one. It could be a malabsorption from low stomach acid. It could be even just a leaky gut thing. But one of the things I'm seeing a lot, especially with my female patients that are estrogen dominant, is excessive menstruation.
Yeah.
So when I'm interviewing my patients and I go into this area about how many tampons, how many pads are you using? How many days are you bleeding for? They're always kind of like, wait a minute, you're like a male doctor. How do you know? So it kind of like freaks them out a little bit. So now that I got a female doctor that's skilled in this area, I want to get your take on, hey, if you're going through this many tampons per day and bleeding this long, maybe it's too much. Maybe that's an early sign of estrogen dominance that could lead to anemia. Can you touch upon that?
Yeah. Yeah, that's a huge one. So if you're continually having a heavy period, you're obviously going to be losing a lot of blood, and with blood goes iron. So another clue that you could have some estrogen dominance is maybe spotting between your periods. Also, if you have really difficult periods like cramps, maybe breast tenderness, you just also issues with like maybe some like emotional things before your periods, you feel more weepy and just feel like a lot more kind of irritability. Those are just some potential clues that your hormones could be out of balance. So and the reason why the estrogen dominance can lead to heavier periods is because estrogen is a proliferator of tissue. So it makes the lining of the uterus become thicker.
Yeah.
And progesterone works sort of like, I say that the estrogen builds it up and then the progesterone kind of pats it down. So if you are too dominant in estrogen, you're going to be building too much of a tissue. And if you're low in progesterone, you're not going to pat that down so you can get some spotting. So really working to balance out the hormones is super important. That goes back to, like you said, the digestive tract. Also, the liver is your main filter for hormones. So doing some work on resetting the liver pathways, doing the methylation support. Milk thistle would be a great herb to add in to help with liver clearance. And then also looking at doing maybe some specific supplements like DIM or I3C. So doing some specific estrogen balancers. Have you talked about DIM on your show before, or I3C?
I haven't really talked about it, but I will leave the floor open to you here.
Yeah. So one of the great benefits of broccoli or the brassica family is that it helps to balance your estrogens, actually. And it helps to clear excess estrogens from the liver. So that's something I'll use in my practice a lot when there is this estrogen dominance kind of picture. And typically just a capsule twice a day of DIM. I use Estro DIM from Orthomolecular, but there's some great supplements from various companies. But it's taking one of the ingredients from broccoli in a highly concentrated form, and then you're doing that for about 3 to 6 months, and we'll see that those estrogen dominance issues oftentimes get resolved. So that's hugely important. And then I don't think there's anything else about the estrogen dominance.
And it's also helping that 2 to 4 to 16 ratio, correct?
Yes. So preventing that potential breast cancer risk. Yeah.
And how does that ratio flip? I always mess it up. I don't ever test the specifics. Is it we want to get less of the 4 and 16, more of the 2?
You want more of the 2. I think
more
that
of the 2.
Like you want to be too good. So I think it's
too good. That's it.
Too good. Yeah.
I always confuse those. It's like,
I know.
So more of the 2, too good. I will never forget that now.
Yep. You want to be too good.
Perfect. Too good. Love it.
Yeah.
So looking at just objective markers here, because I always kind of ask my patients this every time we have a new patient consult. So what would you consider too much for tampon usage? Like it's a marker of that, you're bleeding too much. Would 4 or more be kind of that threshold? Maybe.
I think I would say 4 is a good little threshold marker. If it's more than that, I'd look into seeing what's going on with the hormones.
And then 3 days would be kind of like your cutoff?
Yep. I mean, you want maybe the first 2 or 3 days to be a little bit more typically it's more on the heavier side, but if you find that after 3 days, you're still going through like 4 or more tampons, I would look into things. Yeah.
Got it. All right. That really helps. So I see a lot of patients that, they're anemic, and then you also got some patients that may have fibroid issues and they're anemic, and they're also taking iron with the fibroid. Can you talk about why taking iron may actually make that fibroid grow bigger?
Well, it can affect your estrogen levels, affect your hormones. Is that the pathway you were thinking of more?
Well, I've just seen some patients where the iron will actually will fuel the growth of the fibroid, and the fibroid will continue to grow. And you can give all this iron, but it's being sucked up by the fibroid, so it never really gets into the blood where it needs to go.
Right.
Have you seen that before?
Yeah, that's a good one, Doc. I haven't seen that one as much, but that makes a lot of sense. I mean, it can contribute to growth, and we know that iron can feed dysbiosis and infection. Yeah. So it's not that's why I'm always testing to see. It's not one of those things I just give, very casually. You only want to take iron unless, if you really need it.
Right. You're going to give iron, and then you'll follow up with like a ferritin or a saturation or a UIBC kind of thing, right?
Yep. Every time we're doing ferritin, iron saturation, total iron binding capacity, and transferrin. I mean, the full thing. And then looking at the red blood cell count, if you have healthy counts. If you're anemic, you tend to be lower in red blood cells. Your hematocrit tends to be lower, which is basically what percentage of your total blood is made up of red blood cells. And if that's low, that's also a clue for anemia, for low iron. And then your hemoglobin. So your iron is attached to oxygen in the cell.
Yep.
So if you are deficient in iron, you're also going to be low in oxygen too. One little trick to see if you might be low in iron for you guys listening at home, you want to look in the mirrors. You want to look on the inside of the lower part of your eyelids. That's your conjunctiva. So just go ahead and pull down, looking in a mirror, pull down and look in the inner part of your lower eyelids. If you see that that's actually really pale, it should be like a nice rich pink color. If that's real pale, that's a clue that you could be anemic. Also looking at your fingernails. If you push on your fingernails and then release, you want it to turn pink again really quickly. If it stays white for a while, that's also a clue that you may be deficient in iron. And then another little trick too is if you find yourself yawning a lot, like let's say you're doing a workout and you just yawn all the time, that could be a clue that you're just not getting enough of that oxygen, and that might be a clue of low iron too. So just something to pay attention to.
Very cool. Yeah, I love the whole clinical
the little takeaways.
Yeah, the little clinical takeaways, the physical medicine exam takeaways are so great.
Yeah, really helpful.
Yeah, one of the best parts of natural medicine are those little pearls right there.
Yep. Mm-hmm. And also one for zinc that we didn't mention before is if you have white spots on your fingernails, that could be a zinc issue. Or if you have vertical ridges or just ridging on your nails, that could be a mineral issue. So another thing to check out.
Very cool. And also one last thing that I learned too is if you take your hands and you extend your fingers back, like you're pressing them so you're extending it back, that lifeline, lifeline right across there should start turning more red. If it doesn't turn red and stays kind of white, that's another sign of anemia too.
Oh, yeah.
Very cool. Awesome, Doc. You've given us some great information. Last question here I want to touch upon. It's such a hot question, especially with thyroid patients and such. Can you talk a little bit more about iodine and how you use it with your patients and how you kind of, maybe are being a little bit more ginger about it with autoimmune patients? What's your take on iodine?
Yeah, iodine is such a hot topic, and it's so confusing for people because you hear of iodine being so good for the thyroid, but then you hear that most thyroid conditions are autoimmune related. So is it okay with autoimmune? Is it not okay? So there's a camp of people that say, never ever give iodine with autoimmune. For me, the way that I go about it is I always check a full thyroid panel, including antibodies. If I see that there's autoimmune issues, if there's elevated antibodies, I tend to not do iodine with them. Now, sometimes I will, like they'll say, when I do iodine, or let's say I have some sea vegetables, I feel really good. I listen to that, right? So sometimes I will make an exception for patients, but I tend to not, especially if I'm seeing elevated antibodies. If I over and over repeatedly test antibodies and see that the levels are very low and a patient is still having thyroid issues, then I will add in some iodine and just very, very slowly and work up to it. For myself, I had a bad experience with iodine. I did too much of it, and it really affected my thyroid very negatively. So you don't want to take iodine unless you need it. So I will test it for many of my patients, do a blood test and see where their levels are at. But I'm a little bit cautious with using just a lot of iodine. Now,
Yeah, that's smart.
For women who have fibrocystic breasts, it can be very helpful for them to actually apply iodine onto the breasts. I know that Dr. Jonathan Wright, he says to apply it on the bottom of the feet, which I think is kind of funny of a place, but that can be very helpful for kind of those fibrocystic issues or painful breasts with your cycles. But that's how I tend to view iodine. I'm curious about you though.
Yeah, very, very similar. I always look to see if there are antibodies. Again, we know with iodination, which is the process of making thyroid hormone, right? The body binds some tyrosine to the iodine molecule, and in that process, it spits off a whole bunch of hydrogen peroxide. And if we have selenium deficiency, well, selenium normally comes in there and it actually pulls off one of the oxygen molecules and making it water and O2. But if we don't have the selenium there, then that hydrogen peroxide can stimulate that immune system to go attack it. So I think really focusing on, especially when they're autoimmune, really the selenium first is really the best way to go. So I'm totally, in sync with exactly what you're saying there.
Yeah. And are you testing iodine?
You know what? I don't really test it too much. Again, like I'm familiar with Doctor's Data's got a really good 24-hour iodine test. They got a spot test as well. I don't do it too much. I kind of start with the potassium iodine, iodide, and I just start up very gently, and I just load upward very slow with patients.
Yeah.
And it tends to work. I'll also look on the test if they're T4s in the lower end of the range. That's a big building block for T4. So then we'll start using just a little bit of iodine as well there.
And you usually use the potassium iodide?
Yeah, I'll use potassium iodide and iodine. I like the new Lugol second generation because it's got the selenium and the B vitamins and the fulvic minerals and the vitamin C.
Oh, cool.
And I like that because the thyroid actually really wants the iodide.
Yeah.
But a lot of times the breast tissue really wants a lot of the iodine. So I'll give it both together because a lot of times the breast tissue will kind of take it all up and hogs it.
Look at you giving pearls. I just wrote that down. Thank you.
Well, I got a lot of good pearls written down for myself, so I'm super stoked.
Sweet. Give and take.
I love it. So, Dr. Lauren, today's interview was awesome. I want to have you back real soon. I just want you to talk about a little bit more about your clinic. I know you're seeing patients abroad via Skype and the phone, and I also know you have your happy hour special for shots and IVs, and I'm actually looking forward to coming down to Solana Beach at your new clinic and getting an IV really soon.
Yeah. So I work with patients all over the country. That's the benefit of how really, if we have this radio show, we get to reach people all over the world. So it's such a cool bonus that I get to work with patients out of the state and out of the country. So I do that. About half my patients are not even in California. But for local patients, we do have the IV therapy program. Like I mentioned, we have a whole IV menu and shot menu. And on Wednesdays in the afternoons, we have our happy hour. So we call it the happy hour. Really, it's about getting patients in the door. It's kind of catchy, but then we can really do the work of doing the full naturopathic care. So we're doing that every week. Like I said, we finished our website, shinenaturalmedicine.com. But I work with patients over phone and Skype all the time. So I'd love, for anyone listening, if you just feel like you're not really jiving with your doctor, maybe it's been a while since you've looked into things or you resonate with some of the things we've talked about, I'd love to work with you and help you feel a lot better.
Plus, how could you not want one of those cool shots or IVs? Those names are awesome, like the motion of the ocean. How could you not want that?
They're pretty awesome. They're pretty addictive. I love them.
And how about your podcast? I know you were like almost over 1 million hits and stuff. How's that going?
Yeah. So Dr. Low Radio, I've been doing that for about 4 years. And I started as a hobby. It's turned into my main patient generator. It's amazing. It's sort of taken a life of its own. But so every week-ish, I do my show, and it's every week is a different topic. You can find me on iTunes, just search in the podcast directory, Dr. Low Radio. And we have had you on the show a few months back, and we definitely have to get you back on because that was an awesome show. So yeah, it's amazing. It's free content. I think we have 133 shows. It's so much information. And I have some listeners who listen to every single show, and I swear they probably know more than most doctors at this point.
Yeah, you've had so many great naturopathic doctors on there. Your Dr. Sherry Tenpenny on there. That's really, really high quality show, and you do a great job hosting it too.
Thanks. Takes
Awesome,
one to know one.
Yeah, right. I know. Well, I look forward to seeing you next month at Paleo FX. Super stoked and looking forward to hearing your talk. And I love the new site. It looks so good.
Thank you so much. Yeah, I'm looking forward to catching up with you and seeing you in person.
Great, Dr. Lauren. I look forward to chatting with you really soon.
Thanks, guys. Thanks for listening, you guys.
Thanks. Take care.
Got a question for Dr. J? Go to beyondwellnessradio.com/question. Then tune in to hear the answer. Also, if you like the show, review us on iTunes. For more Beyond Wellness Radio, go to beyondwellnessradio.com.